All right, so today's interview is about healthcare and it's about AI, two of the hottest and scariest keywords out there when we do our search. And I have a guest, Chris Hutchins. He is an expert in both, and he's launching a startup in the area of AI. And the whole goal is to make healthcare more human, or at least easier to navigate. And welcome to the brains behind it, Chris.
Well, I'm happy to be here. Thanks for having me, Dave.
All right, so let's dive right into it. So you're saying that healthcare is a mess. I think we can all agree with that, right?
Sure,
And
sure can.
so you think that really technology is going to get us out of this mess. It's going to make it easier for us to do stuff. Give us an example of how AI is helping and what the future looks like in your eyes.
This is a great topic for me because I've spent the majority of my career, 30 plus years, working in the provider sector. And what I've seen repeated over and over again are the challenges we're still facing. There's a really difficult task to integrate data. Transactional information is very different than clinical information, how it gets stored, how it gets managed. Numbers are
You're talking about kind
numbers.
of like diagnoses and like test results, and so a doctor has all the
Yes.
data at their fingertips, right?
Yes, and the concepts you just mentioned, diagnosis information, for example, that's really codified, which seems straightforward enough. But the challenge that exists is that the documentation process that a clinician goes through after a patient visit, or quite often they're actually trying to address some of it while the patient's in the room. Your listeners probably have had that experience. I would be
Mhm.
surprised if they haven't. The difficulty with that is communication styles vary from person to person. You and I might have gone to the same medical school, got the same training, of course. We're using the same tools within our practice, but the way that you communicate is actually going to be slightly different just based on a number of things. Could be nuance, your communication style, could be even a preference.
And you
Some of the
think this
information.
communication differences is really enough to cause harm?
Absolutely, it is, and where that's challenging is there's the concept of discrete fields where data points get put, like coded information. But then there's also unstructured data where a good amount of dictation type of activity actually goes on, and so that
So
information is in this
dictation, like
big
the
text blob
doctor,
as opposed. Go ahead.
the doctor like dictates after the initial meeting,
Yes.
talking about different things that they observed, that sort of thing. That
Mhm.
that often gets lost too.
Yes, and the role that that plays is actually early in the process before it even gets coded for billing purposes. Um, After the physician's finished with their part, somebody actually has to go through the thing and code what was actually captured. But the notes that are taken have to be able to back that up and support it from an audit standpoint. But once that stuff is coded, it then goes through the billing cycle. That's how all this stuff gets launched.
Now let's
Um,
talk about the billing cycle here a bit. When you're trying
sure.
to deal with insurance companies, doctors complain. I've had a few clients in the medical space that have complained about how much the insurance companies they put so many roadblocks in the way. They make sure that
Hmm.
staff can't do a bunch of things, and doctors have to do so much, but
Right.
they're not able to bill for those hours. So it seems like there's almost like a battle there, like a war between
Hmm.
the insurance companies and the doctors trying to agree to different services or different tests as well.
Yeah, that is a significant challenge to coordinate, and I think that's where a lot of our policymakers over the last decade or so have kind of missed the mark. They standardize things in terms of sets of things. Like if you create a loop in a segment where I'm supposed to put a particular type of information, there's some interpretation that's allowed there that basically allows you to use it differently than I would use it. So when I'm on the other end of it and I'm looking at things that are coming through the same field, it may not actually be the same type of information.
Hmm.
That kind of stuff has been going on for a very long time. But the documentation component of it, if you're coding it and you know that, hey, Dr. Hutchins always uses this terminology when he's dictating his note, I know what that means, so I can
Right.
move very
And then
very
and then of
quickly
course that
through
all
it.
changes when somebody retires or they change
That's right.
patients, change doctors and everything else. Yeah, absolutely.
Yes.
I agree with you. I think the regulators did miss the mark, or perhaps they hit the mark that their lobbyists wanted them to hit. That all depends on how
Mhm.
cynical you are.
Right.
But going forward though, what does not to do a softball answer, but like really tell me what does AI how does this get fixed by AI and
Mhm.
what about the mistakes that AI is known for?
Great question. I think the place where I'm most excited is where we're focused on trying to remove some of that administrative burden that we actually kind of put back on the providers. That we used to have a transcriptionist that was actually translating things after the doctor dictated something into a dictaphone. In our effort to really improve things, we dropped the dictaphone, don't need the transcriptionist, the doctor's sitting there keying everything themselves. We've added
Really?
literally hours to their days. If we use this ambient listening, which is something that's going very, very well, where it's being tried right now, it's capturing information during the encounter while the doctor and the patient are in the exam room together.
So you're talking
What
ambient listening that's like basically microphones that are in the room itself.
correct?
And they're listening
Correct.
all the time. So, of course, that brings
Yes,
up privacy issues. People are
of course.
concerned who gets access to that, right?
Hmm.
But if there's some sort of protection on that, I mean, how can we ensure that only the doctor and the patient would see that private information?
There's two things that are important there. One is in healthcare, the Hippocratic Oath applies across the board, whether you're a physician or you're an administrator. First, do no harm, right?
Mhm.
So we actually have to explain what it is that they're using the technology for, and there's some legislation that's happening as we speak, mandating transparency and disclosure, which means what we are
That's
using
smart.
it for has to be explainable to the point where a patient can make an informed decision, yay or nay. Do I want you to be listening, use this technology listening in the room?
And they can like say no and literally they'll
Yes,
turn the microphone off and nothing's being recorded.
that's correct.
Okay.
Yeah, but
What do you think the percentage of people are that choose like I'm very much a privacy guy, so I'd be like, "Oh, turn it
sure.
off. I just want to talk to you." But I do think that I'm in the minority. I mean, I set all my settings to private on my phone. I don't
Mhm.
like apps spying on me, all that stuff.
Right.
Do you think the majority of people just don't care?
I don't think it's that they don't care, but I think in the explanation, when we help them to understand what we're doing with it, it matters because patients have really been frustrated because they get denials from the insurance companies all the time. Well,
Mm,
if that communication that happens, if it's recorded accurately, it's going to reduce the errors in the coding that actually cause some of the billing to get denied.
I see.
So
So it's
having
not that
that
they
some
don't care about
understanding.
privacy, they care about effectiveness.
Yes, but they also care about privacy, which is the challenge that we deal with in the healthcare space when it comes to any technologies we're working with. And this generative AI and ambient listening, these types of things, we'd actually have to have those firewalled within the organization.
Of course.
But there's also the realization that people need to have that your information is being stored by your physician now,
Right.
and it doesn't become more or less accessible whether we're using AI or not.
I think that's really important, but and if it's not happening, then you're gonna have lawsuits,
That's
pretty
right.
soon about that sort of thing and regulations for sure. So what about they call them hallucinations? I just call them
Mhm.
mistakes, or most AI people now just call them
Sure.
mistakes. I mean, I see it all the time in even AIs. We've got an AI listening to us on this call, and
Right.
I can't tell you how many times I've had somebody, review the transcript of the AI and say, you told me that the deal was this, and this. And,
Hmm.
we go back to a recording and I did not say that. The AI
Right.
made it up, right? So
Yes.
what do you do about that in the medical space? And are you building your AI differently because of that?
Yes. There's two things that I think about there. Is one is AI. It makes assumptions. Clearly,
Mhm.
it's going to respond to you based on what information it has and whatever information you've given it. That's obviously the first input that it has, but it
Yeah.
also has access to a whole bunch of other stuff depending on how integrated it.
But it's
It's
also
got
been shown,
information.
the LLMs have also been shown that if it doesn't have the
Mhm.
information, it will make it up. It'll try to lie to
Yes.
you
Mhm.
because the only thing that it's been trained for is positive response, is I got the response I was looking for, not I got
Right.
an actual correct response.
Yeah, and I think that that's where it's really really important, and we think carefully how we're using it.
Mhm.
So it's really about communication in a dialogue between the physician and hopefully the electronic health record that he's already got that has patient history in it. um, processing a massive amount of information in like literally fractions of a second
Hmm.
is not possible right now for the human brain to do. But we've continued to layer on so many different things that have to be accounted for. And what's known about clinical care today is very, from a transactional data set standpoint, it's probably at least 10x what it was even 2 years ago.
Right. So
So
I
there's
hear
a
what you're
ton
saying.
of,
Like before
right?
AI, they called it big data, and we were dealing with big
Yes,
data, and we were trying
that's
to use
right.
algorithms to crunch it. Now we're using AI to crunch it. But again,
Right.
the same concern is there. Like in the legal community, they've jumped on
Mhm.
this right away. There's
Yes,
been lawyers who've been disbarred who used
sure.
generative AI, to make contracts. So now everything
Right.
you can certainly use it to make clauses, to make contracts, but it has to be reviewed by a human lawyer before it gets signed,
Correct.
or they could lose their license. Is there going to
Yes.
be something similar with people that it's like
Yes.
even my backup camera on my car, there's a little line on there that says, check your surroundings. Like, don't
Yes.
freaking trust just the camera. Use
That's
your
right.
eyes too.
Well, I think that's the critical piece in healthcare. But we're not trying to replace the clinical judgment. We can't. There's no possible way. There's an evolution always going on, and you all know that we're discovering new diseases all the time.
Hmm.
So, COVID's a great example. When it first hit the scene, it looked like a lot of other things, and if we were trusting our models, we would have thought it was one of those things,
Yeah. Well, we had
right?
we
So
we experienced coronaviruses before. Yeah.
yes. So the key is just providing the compute power to process as much information as we possibly can so that the doctor has everything that they could possibly have available to them to make a diagnosis or to prescribe a treatment. That's really where I think the value comes in, because we can process so much so fast and we
Mm.
can get it to them. But it's not going to replace their judgment. It can't. But what it can do is it can reduce the time that it takes them away from focusing on the patient. We can give that time back to them so that encounter is much more meaningful, and they can actually probably get even deeper into what's
Right.
happening with that patient and get a much better sense before they make a decision. So that for me is the major difference in approach. We just have to think about how do we enable the clinicians and arm them with the best possible information possible at that point in time.
But there's also probably training of the
Yes,
clinicians that not to base a treatment on a particular data set unless you double check it if it came
that's
from
right.
AI, right? Like, do you have like the AI and then you have the original data that they can double check?
Mhm. Yes, and I think that's another important factor. And even from an administrative standpoint, and the guardrails we have to bake in there are
Mhm.
really important.
Well, the
Dr. Dave,
administration stuff, you've got me convinced. I'm
yeah,
completely convinced on that because
right,
the amount of paperwork that's needed to submit to insurance companies and such.
right,
Just the only thing that people are worried about is those misdiagnoses.
right. Yeah, but you and I might be doing the same kind of care, right, as physicians. If you're taking 3 minutes to review your post-visit documentation and I'm taking 25 seconds, that should be setting off flags to look at both of us to figure out what's the best practice here. Is
Mm.
someone just getting too comfortable too quickly and just trusting it? Because that's something we have to look at. Or maybe it's that you're taking a lot longer to look at it because you're not seeing it the same way, or the training's not been accurate or
Mhm.
appropriate. There's a number of different things, but we have to have the ability to monitor these things as we're working through implementation processes and thinking about that. We have to look at those angles. So our compliance, information security people, our legal teams, they in our
Yeah, I bet you got so
quality leaders,
much.
they
Yeah,
all
so
have to
many
be involved in
layers
it.
and everything to go through. Yeah, no, and this is
Yes,
obviously the future.
right,
Doctors all clinicians are already so overwhelmed with
that's
the
right,
potential data, and it's only getting bigger. I mean, we're talking
right,
about potentially, people, especially with chronic conditions like diabetes and others, to have,
mhm,
wearable devices that
right,
store a tremendous amount more data
that's
than
right,
than they think. I mean, it was just a revolution to store insulin data, and now it's
mhm,
possible to store every possible vital sign at every moment for the
right,
last like 9 months. There's no way you could go through that as a doctor, but with AI, yeah, you could
mhm.
find something that nobody else finds for sure.
That's
So
right.
I
Now,
think it is the
uh,
future, absolutely.
Yeah, I love that. I love the example you just gave because streaming information, it may look like I've got high blood pressure and just because it's looking outside of a normal range.
Hmm.
But as my doctor, you know that I have a medical history and that actually is not abnormal for me.
Yeah.
It's controlled to a certain point. That kind of subjectivity can be there. And without the right context, it's people aren't numbers. I guess
Yeah,
is
and
the
it's
bottom
also,
line.
I think this
Right.
also does a lot for, let's call them like the diseases of the future. Like past
Mm-hmm.
diseases had one disease had one cure. You know, bacteria had, it had an antibiotic and things like that. A
Right.
virus has a vaccine. But going forward, if you look at dementia, it has multiple cascades of causes. Even something
Yeah.
like migraines and stuff, that tremendous amount of people suffer from migraines.
Right.
Autoimmune issues. I've had a lot of autoimmune diseases, issues my whole life. And just, I mean, I like vitiligo. I don't know if people can see my two-tone skin there. That's, just the one that's visible. But, it's plagued
Mm-hmm.
me my whole life. But it had a multitude of causes. And when I
Right.
solved it, it had a multitude of solutions. So it really
Yes.
does take crunching all that data to figure out what the solution is, for sure.
No, and you highlight something that's really an important thing is why we can't avoid this. We have to really be seriously pursuing it, figure out how to use it because people are already taking things upon themselves. I
Mhm.
mean, it used to be WebMD, now it's AI, it's Chat GPT.
Yeah, it's
So
apps on
if
your
you can't,
phone. It's everything. Yeah.
right,
So as people start using it, you have to compete. Okay. So what stage are you at with your company, and what's your next big, hill to climb?
well, this is actually month three. A lot of it's been foundation building and doing a
Nice.
lot of outreach. What kind of made me jump into it to begin with was as I was writing about some AI and technical debt challenges because in order to get to AI, your foundation's got to be in pretty good shape. And it's a hard thing to get done when growing by acquisition, the critical systems that usually get migrated and standardized are the financial and the HR type of things. The clinical records are probably the most difficult of all. But as soon as I started writing that stuff, I started getting outreaches from a lot of founders and CEOs. About 30% of them were physicians who were just fed up. Their workflow problems aren't being addressed, so they're coming up with ways to do it themselves. And then the other groups that I was hearing from were really investors. Some of them were private investors, some of them were for some pretty large venture capital firms. But it became apparent that there is a need to help match the investors with the technologists and then partner with the right organizations who are ready to do some implementation of AI in a space that correlates to what these folks have been working on. And some of it's really kind of leading them to what the pain points are that
Hmm.
clinicians are dealing with so that we start from listening instead of, hey, I got this great tool, you should use it.
Hmm.
People like
Oh,
me have invited clinicians into too many demos and they roll their eyes like, again, you didn't ask us what we needed. You're throwing solutions at us.
yeah. So, yeah, I think that there's definitely a lot of cause for concern, but you've addressed a lot of the concerns. You seem to be treading carefully, but at the same
Yeah,
time, this is the future. We accept
it
it,
is.
or we miss out on all the data that can actually save lives. So, best of luck
Right.
to you going forward. You're certainly brains behind this startup, and I will track your progress and get updates, and hope to check in later.
Um, Thanks again for having me, Dave. It's a fun conversation to have, and I wish all my co-founders out there in the world that are trying to solve these problems. I wish you guys the best of luck too. Let's get this right.
Awesome.